other women who have been recently diagnosed with breast cancer?
Just know that it's not a death sentence. It doesn't have to be a death sentence. Find out. I believe everyone should have a Fab Five. So that's 5 people that can hold you down, pray you up, and keep you covered in the event that a cancer diagnosis or any type of health situation arises. And so your Fab Five are individuals that you trust with your story, you trust with your secrets, this health situation. And so have those individuals, 1 or 2, attend your appointments where you're not missing anything, that they're taking notes because you're still in the twilight zone of having to go through this. And so I also suggest that you go to a hospital, a treatment facility where they do cancer and they do cancer well. Not that they have a cancer department, but the hospital itself is cancer teaching, treating, forward-thinking cancer facility, because you will have the best of the best there being able to treat you.
Let's switch gears and talk about prostate cancer. 1 in 4 Black men will get prostate cancer. That's a dad, uncle, brother, partner, or best mate. I was diagnosed with prostate cancer in April 2022. Surviving a battle with cancer, Lynn, and I'm sure you can attest to this, it gives you a whole new outlook on life.
Yes.
And I want to bring awareness to prostate cancer and continue to be a voice for people, especially my brothers battling this disease. Why is Prostate Cancer Awareness Month not talked about as much as Breast Cancer Awareness Month?
Great question. And so I don't have the answer to that, but shows like yourself, Mother, you're bringing awareness to it. And so men like yourself who have the microphone, they have the platform, keep screaming it to the top of the lungs, to your lungs. Keep sharing, keep talking about it. The women who are listening to you, who have men in their life, their brothers, their fathers, their husbands, their uncles, begin to have that conversation. My purpose is to take the stigma, the fear away from the name cancer, that word cancer, and we'll be able to talk about it openly and honestly. The other thing is, if you have a history of cancer, prostate, breast, any type of cancer running rampant in your family, then I need everyone attached to that family to get hereditary risk assessment. I need you to know your family risk. And that just entails a blood draw. You're answering some questions. Who has cancer? What type of cancer? Your mother, your father. And you'll be able to when they take that hereditary risk assessment, you want a full FULL cancer panel screening. So not just BRCA1 and BRCA2, because I was negative for both of those BRCAs, and I still got triple negative breast cancer. And triple negative is a very aggressive cancer that runs rampant in our community. And so that full cancer panel screening that's your way of being proactive. And let's say a gene comes up, and that gene has not turned on. Well, now your geneticist can have a conversation with you on how to prevent that gene from turning on. So now you're just being proactive. But we have to remove the fear and the stigma from the word cancer, and the fact of I'm just going to pray and I don't want to know about it, and Jesus got me. And I know he does, but that's why he has all of these doctors and all of these tests here, because he got you. And we just have to lean in to get the information and not be afraid to know.